Hello, my name is Vivica Suharski, and this is Pneumonia Vaccines, Who, When, and Why. My name again, Vivica Suharski, for Indiana State University, Class Nursing 444, Community Health Nursing. Purpose of this module: keeping track of what vaccines are needed and when can be tricky. To achieve the maximum effectiveness of immunizations, they should be given at the right time. There are currently multiple immunizations for the prevention of disease. Healthcare providers are entrusted to know who needs certain vaccines, when, and help the patient understand why they need them. The purpose of this module is to help healthcare providers determine who needs what vaccine, when, and what type. At this time, please attempt the pretest. Learning objectives. What is the vaccine for? What is pneumococcal disease? Available vaccines, and the population that should receive the vaccine. Learning objective number 1. What is it for? What is the vaccine intended to do? Immunizations are given to provide an individual with protection against a disease. Helping others understand why vaccines are necessary can help aid them to better health. Learning objective number 2. What is pneumococcal disease? What is the pathology? Streptococcus pneumoniae is a common bacteria found in and around humans. Pneumococci are common in the human respiratory tract and can be found in 5 to 90% of a healthy individual's nasopharynx. Up to 60% of individuals can be carriers of the bacteria, not suffering from any of the diseases associated with the bacteria. The bacteria is responsible for pneumonia, bacteremia, and meningitis. There are more than 100 strains of the bacteria. These are known as serotypes. Some may cause mild illness, while other strains can cause more serious illness. Pneumococcal infections will typically belong in one of two categories: non-invasive and invasive. Non-invasive infections occur outside major organs or blood. These are typically considered less serious. Invasive forms of the infection occur inside major organ systems or blood. These are the more serious of the pneumococci infections. Non-invasive infections include bronchitis, sinusitis, and otitis media. Bronchitis is the infection of the tubes that run down from the windpipe and into the lungs. Symptoms include wheezing, coughing, chest tightness, and malaise. Sinusitis and otitis media are infections of the sinuses and inner ears. Signs and symptoms include inflammation of the inner tissues, pain, sinus drainage, difficulty hearing, headache, and fatigue. Invasive forms include pneumococcal pneumonia and meningitis. Pneumococcal pneumonia is a serious lung disease. It is incredibly infectious, with the bacteria settling in the lower respiratory tracts, causing inflammation and excess fluid production in the lungs. This can be life-threatening. Pneumonia kills approximately 1 out of 20 people who contract it. Meningitis is also life-threatening. Inflammation of the linings of the brain and spinal cord due to infection. If not treated swiftly, death can occur. Nearly 15% of cases will result in death, while 25% of those who recover suffer long-term effects. Learning objective number 3, available vaccines. What are the forms available? Currently, there are 2 vaccines in the United States that protect against multiple pneumococcal strains. The FDA has approved 2 other vaccine types, though indication is not yet known. Knowing what vaccine is appropriate for which individual can help prevent pneumococcal disease. There is no vaccine for the complete cure or prevention of pneumococcal disease. Vaccine types: pneumococcal conjugate, or PCV13, protects against 13 serotypes. Pneumococcal polysaccharide, or PPSV23, protects against 23 serotypes. The CDC recommends the vaccine for young children, older adults, and those with varying medical conditions. Learning objective number 4, population. Who should receive the vaccine? PCV13 protects against 13 of the more serious strains of the pneumococcal disease. It is recommended for infants and young children. This is typically part of a routine immunizations for infants. The dosing schedule are for ages 2, 4, 6, and 12 to 15 months old. Not recommended for healthy individuals under the age of 65. Given to individuals 65 or older with varying indications or health risks. For individuals needing both PCV13 and PPSV23 vaccines, the PCV13 is typically recommended to be given first. The PPSV23 vaccine protects against 23 strains of the pneumococcal bacteria. It is recommended for all individuals 65 years and older. For individuals requiring both, indication is to be given after the PCV13 immunization, as it stimulates memory B cells for better immune response. There are other factors to consider. Smoking history. Those with smoking history may require additional doses of either vaccine. Breathing disease. Individuals with compromised breathing disorders may need additional vaccine doses. Current illness. Those that are currently ill should not receive any vaccine. And vaccine allergies. Discuss the need for vaccines if an allergic reaction to vaccines have been had in the past. The vaccine available for the prevention of pneumococcal disease are recommended for most individuals. Depending on age, circumstances, and health history, one may receive multiple doses at varied times. Speak with a healthcare provider for the specifics of need. At this time, please attempt the post-test.